In the case of the Sputnik 5 or Sputnik V vaccine, we have been in discussions with the Russian manufacturer for quite some weeks now, and I've indicated this before because when we review the data from the vaccine, we saw that the vaccine is about 90.6% efficacious. And of the vaccines so far, this one has very high efficacy. And so we have started discussions with them in order to be able to get some of these vaccines to Guyana. Those discussions have advanced, and we have been able, through our Food and Drug Administration here, to issue an emergency use authorization for these vaccines. We have also issued emergency use authorization for the Sinopharm vaccine, which has an efficacy of 79.4%. Our process of issuing emergency use authorization, we looked at three main sources how we can do that, or three main ways in which we can do that. The first is if the vaccine has been approved by what is called a stringent regulatory authority. So, when we talk about stringent regulatory authorities, we're talking about the FDA in the United States, in Canada, in the UK, in Australia, and in Europe, they have a similar body, but it's named differently, not FDA. So once it has been approved by these authorities, then we would use the principle of reciprocity to be able to approve it here in Guyana. Another way of approving these vaccines is if they've been approved by the World Health Organization. And in the case of, so far, the WHO has only approved two vaccines, and that is the Pfizer vaccine and the AstraZeneca vaccine. They have Sputnik, which is going to be, they have submitted the paperwork, and I'm sure very shortly that that is going to go through a process of approval. And similarly with Sinopharm, which the WHO already has the documentation, and they should be processing that as well. And the third method that we use is if this vaccine has been approved by one of the bigger countries in the region or part of South America, the Caribbean region. And in the case of the Sputnik vaccine, we have seen that it has been given emergency use authorization in Brazil and in Argentina. And my understanding too that it has been used in St. Vincent and the Grenadines. So we are working with these bodies, and based on their findings, our FDA has been able to grant that emergency use authorization.